National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm Dr. Jonathan Beatty, naturopath and a health expert here at nationalnutrition.ca. Every day in my practice, I encounter a condition called colitis. Now, colitis is really a representation of inflammation of the colon. It in and of itself is not a disease. There's actually many causes behind colitis. It can be related to celiac disease. It can be related to autoimmune conditions. One of them is ulcerative colitis. There's also Crohn's disease. And then it can be related to different types of infection. So again, colitis itself, not an actual diagnosis. Instead, it's just a term we use to describe inflammation of the colon or of the large intestine or the latter half of the intestinal tract. That being said, if you do have colitis, there are a few things you can do to help manage it. What you first need to understand are what are the triggers or what are the items that will actually increase the inflammation or increase the disease state of the colon. Oftentimes in my practice, I find certain foods will do this. So oftentimes if somebody has colitis, they'll want to avoid coffee or heavily acidic foods. This may just be that the acids will irritate the already inflamed tissue. But that being said, if you had a burn on your hands, you wouldn't want to put, say, like hot pepper sauce on that because it's going to be irritating to a lesion. Whereas if you had, normal skin in that area, it wouldn't be as problematic. The same thing goes to the intestine. Anytime there's inflammation in that area, there may be certain foods you want to avoid temporarily to avoid further inflaming the area. Additionally, I'll often typically recommend my patients avoid major food allergens. Oftentimes colitis can be caused in response to a food allergy or what we call oftentimes a food sensitivity. So I'll typically recommend my patients, try avoiding gluten, try avoiding dairy, try avoiding eggs. Those are 3 foods that can often be related to colitis symptoms. And what I find is avoiding those can help it to clear up, especially if that's the cause behind the condition. Also, of course, identifying if there is an infection can be very important. And your doctor can do a number of tests to rule out infection as the cause behind the colitis. And then if it is an infection that's creating the problem, you can get a treatment specific to that infection to make that colitis go away. So if you do get diagnosed with colitis, again, push a little further, make sure your doctor figures out exactly what's creating the cause so that you can treat it effectively. That being said, managing the symptoms while you're getting that proper diagnosis can be very helpful, at least for improving quality of life while you're going through the process of trying to determine a proper diagnosis or a proper idea of what's creating the colitis in the first place. So if you have colitis, it doesn't mean you should suffer until you get a diagnosis. So there are a few things you can do to help reduce the inflammation of the lower intestine. And one of the things that I really like to use with my patients is a herb called Boswellia Serrata. And the reason I like this is it's well studied to reduce inflammation in the colon. So it's very, very effective at treating colitis. I'll also typically pair that with anti-inflammatory enzymes. I really like to use Bromelain and Serratiopeptidase. I find these very effective enzymes for the management of inflammation. And if taking those 2 enzymes, any enzyme you're using as an anti-inflammatory does need to be taken on an empty stomach. So just make sure that you don't eat about an hour around taking those medications or taking those enzymes, because otherwise they just behave as digestive enzymes, breaking down the proteins in the food you ate and not breaking down the proteins that are actually instigating the inflammation. Additionally, you would look at supplementing with fish oil, specifically one high in EPA or Eicosapentaenoic Acid. The reason behind that is EPA is really good at helping to limit inflammation, and this can actually change the way in which your body produces inflammation by lessening the overall inflammation produced. So fish oil can be very, very effective in people that suffer from colitis. And then, of course, the last thing I like to use is Aloe Vera Gel. And the reason I like aloe vera so much, the same reason you would put aloe vera on a burn to help ease the inflammation that's creating a burn, aloe vera works topically in the colon to help reduce inflammation. So these are some tips you can use if you suffer from colitis, and remember, get yourself a proper diagnosis so that you can make sure that you can get rid of the colitis for good and you won't have recurrent bouts of it. So I hope the tips that we've talked about today help you out in the management of your colitis. Check out more of our natural health videos, subscribe, and if you have any questions or comments, please post them below. And always remember, knowledge is health.